Hi everyone, I am Dr. Divya Niranjan, consultant obstetrician, IVF specialist and laparoscopic surgeon at Emmess Women Care Centre, Kanchipuram. November being the preterm labor awareness month, I am here to talk a few words on what causes preterm delivery, how to identify the risk factors and how we try to manage this condition. So preterm delivery is a state where the mother goes into labor even before she completes 37 weeks of gestation. So this labor will be associated with cervical dilatation and delivery of the fetus before 37 weeks of gestation. So who all are prone for preterm delivery? So if you see, whenever the uterus is over distended, like in a multiple pregnancy, twins or triplets, or if the liquor around the baby is high, more than 25 centimeter, or if the mother has undergone IVF treatment, or if the mother has some uncontrolled diabetes or hypertension, these patients are prone for preterm delivery. Sometimes if the cervix is very short, that is if the patient has cervical incompetence less than 2.5 centimeter, and in case she has had any previous history of preterm delivery, then these patients we have to monitor them more judiciously than the other patients, right? Okay, so how can a woman identify whether she is going into labor, preterm labor or not? She will have regular uterine contractions, that is, she will experience pain at regular intervals, and it may be associated with some excessive white discharge or sometimes bleeding PV, or sometimes even watery discharge PV, which means her membranes have ruptured. So these, if the patient has any of these symptoms, she has to contact the healthcare provider immediately, right? Okay, now how do we manage if the patient goes into preterm labor? So what we try to do initially as the initial step is, we try to stop the uterine contractions using tocolytics, right? And to protect the fetus, we give magnesium sulfate for neuroprotection of the baby, and we try to give steroids to give lung maturity for the baby, and so that it can withstand the stress or postnatally, right? And any of these above risk factors which I told you initially, if the patient is having, we always identify these risk factors and we always try to support this pregnancy using progesterones to prevent preterm delivery. So I hope this video was useful. Thank you again. Thank you Sun Pharma for giving me this opportunity. Thank you.